We are following that deadly Ebola outbreak in Central and East Africa. The World Health Organization warning it could be much larger than what is being reported, and there is significant risk of local and regional spread. CBC's Anna Cunningham is on this story for us in London. Anna, what's the latest?
Morning, Linda. Well, the World Health Organization here really raising the alarm this morning about Ebola. At least 80 people, they say, have died, and there's over 250 suspected Ebola cases. Now, the WHO says this is a rare strain of Ebola. It's actually named Bundibuya. Let's just bring in a map to give you the location of the concern about Ebola. You can see the Democratic Republic, that red zone up in the northeast of the country, is the region of Ituri. Now, its capital, Buni, has an airport. At the moment, all confirmed and suspected cases are in the DRC, except 2 which have been found in neighbouring Uganda. And Linda, the WHO says those people travelled from the DRC. Now, we know that when there have been previous Ebola outbreaks, if you remember back to 2014, we've seen images like this, the urgent delivery of vaccines, people having their temperatures checked. But I think what makes this more urgent at the moment is there is no vaccine for this particular Ebola strain. We've had a statement from the WHO's Director General. Let's just read you through some of what he says. There are significant uncertainties to the true number of infected persons and geographic spread associated with this event at the present time. In addition, there is limited understanding of the epidemiological links with known or suspected cases. Now, Linda, contact tracing and isolating cases will be a priority, but the DRC shares 9 borders with land borders. And at the moment, we're hearing Rwanda has already closed its borders. I think we can expect to see potentially some more countries doing the same.
Yeah, so can you tell us a little bit more then, Anna, about just what's being done to contain the spread?
Well, at the moment, we're hearing from the DRC there is no emergency screening centres that have been set up in this region. And it's also becoming difficult to isolate people. The WHO says they believe there may be many infected people still within communities. Let's just take a quick listen to one medic from the Ugandan Health Ministry.
These people need some support for their circulatory system. They are losing a lot of water. They are losing blood. They need to be supported. But now, as our care has improved, we've learned that we can reduce the fatality rate.
Linda, the DRC is Africa's second largest country by land mass, and this particular Ebola strain we've seen has already spread, and we're now hearing that it's also been identified in a major eastern city of Goma in the DRC. There's another complication there because that city is currently under the control of the armed group, the M23 rebels. Linda.
Anna, thanks very much. That's the CBC's Anna Cunningham reporting in London.